Bismillahirrahmanirrahim. Today we are going to discuss acute MI, acute myocardial infarction. What is myocardial infarction? The word myocardial is referred to myocardium. Myocardium is the middle layer of the heart. When there is suddenly stopped blood supply to the myocardium, so, so we so there is infarction occurred, and that infarction is called myocardial infarction. Now come to the case. We have a case that a 58 years man came to the clinic and he was complaining nausea, vomiting, chest pain. A chest pain was characterized by radiating to the left arm and neck and to left shoulder, and the pain was not recovered by rest, meaning there was unstable angina. These were the characteristics of pain. uh, on examination, when the doctor examined the patient, the pain was characterized by frequency. If you see frequency of the pain, it was more than 20 minutes, and it was not recovered by what rest, unstable angina. So there were some symptoms, signs and symptoms: sweating, nausea, vomiting, palpitation. The patient heart rate was too high, and dizziness. Dyspnea, he was feeling that difficulty in breathing. His consciousness was altered, changed. He was not aware of all the things at all. On examination, the doctor taken history, and in the past he was experiencing hypertension, but he did not care of this, and he was diabetic too, and he was not caring of his health too, and due to this reason, he may be experiencing in the past silent MI, but he was not aware of it all. On with investigations in ECG, there was ST elevation and ST segment elevation in the ECG, including the lead 1, 2, 3, and AVF. So it shows myocardial infarction. Tropi was positive. When the tropi positive, it show there is a problem in the heart muscles. Infarction, it shows infarction, cell injury. CBC and C-reactive protein was rise, AST was rise, and DH was rise, and there was somehow damage to the heart muscle. Due to there was a pain. You know, when the blood supply is suddenly stopped to the heart, what happens? In the blood there are nutrients, oxygen, and other